朋友们，大家好！我们现在一起学习健康自主的这个管理。健康呢，就是要自己能够把自己管理好，别人管理你的时候呢，你也能参与到里边去。我们现在呢，给大家读这个一篇文章，这里边有好几篇文章。今天我们读呢，就是这里的这一篇文章。我们这里鼓励大家呢，就是进来以后朗读的方式是以不准备，直接来用自然拼读法来朗读的。那么今天呢，我现在为大家录制这个叫17 Modifiable Risk Factors Shared by Stroke, Dementia, and Late-Life Depression. Age-related brain diseases such as stroke, dementia, and late-life depression can develop in older adults, but individuals can lower the risk through behavior and lifestyle changes. At least 60% of stroke, 40% of dementia, and 35% of late-life depression are attributable to modifiable risk factors. Globally, neurological disorders are the leading cause of the disability-adjusted life years. Previous research has identified overlap in modifiable risk factors for these age-related brain diseases. However, the effect sizes of risk factors for each of the three diseases have been lacking. Knowing the effect size could lead to the development of holistic tools or modules to facilitate the prevention and management of age-related brain diseases. Researchers at Mass General Brigham identified 17 risk factors that you can modify that are shared by stroke, dementia, and late-life depression. The good news is that by changing one of these risk factors, you are reducing the risk for three conditions. They note that brain care, unlike heart care and cancer prevention, has not been considered in preventive health, even though one of the best ways to prevent stroke and dementia is to treat high blood pressure. A 2024 article published in the Canadian Journal of Cardiology reported that only about 2/3 of Canadians have their blood pressure controlled. The research team examined the scientific literature for previous published meta-analysis of risk factors associated with stroke, dementia, and late-life depression. First author Jasper Senf, MD, postdoctoral fellow at the Same Lab at the Brain Care Labs at Mass General Brigham, commented, dementia, stroke, and late-life depression are connected and intertwined. So if you develop one of them, there's substantial chance you may develop another one in the future. The researchers also calculate the relative impact of each risk factor on measures of quality of life and premature death. The findings published in the Journal of Neurology, Neurosurgery, and Psychiatry in April 2025 included, this is a very current article, 这是最新的文章 published 2025年4月份发布的。So it's including the 17 modifiable risk factors. This should read together. The 17 modifiable risk factors were blood pressure, kidney disease, fasting, plasma glucose, total cholesterol, alcohol use, diet, body mass index, depressive symptoms, cognitive activity, hearing loss, pain, physical activity, purpose in life, sleep, smoke, social engagement, and stress. The two risk factors with the most significant impact on the incidence and the burden of these three conditions were high blood pressure and severe kidney disease. Being physically active and engaging in leisure activities with a cognitive component was linked to a lower risk of disease. Still, the researchers believe that the link may be symptomatic rather than cause and effect, as people with a brain disease may be less able to engage in physical and cognitive leisure activities. Mass General Brigham researchers, developers of McCann Center Brain Care Score, incorporated these latest research findings into their score, which provides a scientifically valid answer to a key question: what can I do to take good care of my brain? Senior author Sanjola Sain, MD, PhD, MSc, principal investigator at the Brain Care Labs at Massachusetts General Hospital and a founding member of the Mass General Brigham Healthy Care System, commented that the results show that there are many different steps individuals can take to lower their risks for these age-related brain diseases. The research team calls for future research on modifiable risk factors of late-life depression and randomized controlled trial to test an intervention using the brain care score. Study review. Jonathan Rosand, MD, MSc, founder of the Global Brain Care Coalition and the G.P. Kistler-Endold Chair in Neurology at MGH, commented, "Healthcare is increasingly complex, but these findings remind us that preventing disease can be very simple." Why? Because many of the most common diseases share the same risk factors. The study authors note that these findings could guide prevention strategies. So this is one article we read, and today is read by myself, which is okay. So we stop this one, then we record another one. Thank you very much to like to join us to read the article. The requirement is we take the articles to read without preparation, and which means invite you come in and read the screen and use 自然拼读法，使用自然拼读法读你不熟悉的文章。我们没有时间去准备，我们就是拿起来读。我们的目标要读到什么程度呢？要读到你旁边坐一个老外，他基本上都听懂你在读的什么了，但是你自己可能不懂。That's okay. Even you read it out, you cannot understand because so many of the new words, but other people next to you, they understand because the English is their mother tongue language, right? So we are going to practice, open our mouths, practice our muscles, and read the articles. Okay, thank you very much.